The same people who turned the COVID era into an opportunity to manipulate the masses are now up to the same antics, building out their surveillance and social shape shifting architecture. Nothing quite says, trust us with your health, like coordinated and orchestrated ad campaigns designed to nudge and control your every move. So let's dig in. Our so-called public health overlords at Health Canada and the Public Health Agency of Canada, called PHAC, those same ones who turned the COVID era into a taxpayer-funded behavioral manipulation exercise, are once again spending millions of our taxpayer dollars on psyops without a shred of our knowledge or consent. The latest is building out their surveillance architecture under the guise of experimental marketing. Yeah, you heard that right. Marketing. Because nothing says trust us with your health like slick ad campaigns designed to nudge, prod, and control your every move. This comes from a tender notice straight from the Government of Canada's procurement website. Health Canada and PHAC are hunting for a contractor to deliver experimental marketing services for their public health campaigns. It details in-person events, virtual shindigs, digital outreach, the whole shebang. Deliverables for this contractor include event planning, creative development, stakeholder engagement, and oh so important, performance reporting. Because of course they need to track how well their mind games are working on us. The topics range from healthy living, substance use, food safety, and infectious diseases. Sounds innocent until you factor in that it's a continuation of the behavioral science playbook unleashed during COVID. Remember those endless ads, the fear-mongering PSAs, the nudge units they hired to psychologically engineer compliance? Millions upon millions funneled to behavioral insights teams, all to make us mask up, lock down, and inject without question.
I think, coming back to evaluation and science, I think it's important when applications are being stood up that there is an actual integrated evaluation and research aspect to them. Otherwise, you have no idea whether they work or they don't work. So maybe government can at least play a role in that space. We've certainly seen a growth of these applications, and we have our own applications too that nudges people and reward them for healthy behaviors or giving them badges or these kind of rewards. And I don't see people doing that research as much as we would like. So maybe I'll turn it back to chief science officers to see if they can help. But I think regulation of social media platforms is the one that governments have been really engaged in, and that's quite a massive piece of space of regulation that is still undergoing debate.
There was no debate, no consent, just taxpayer-funded propaganda, and now they're expanding it. Experimental means full-on experiment. They want to get in your face, in your feeds, in your communities, shaping behaviors on everything from what you eat to how you handle the next infectious disease scare. Naturally, there is hypocrisy baked in. All of this has to meet the Government of Canada's standards for accessibility, bilingualism, privacy, and inclusivity. Privacy, that's kind of ironic coming from the agencies building a surveillance state. Give me a break. This isn't about health, it's about control. They're tendering out task authorizations for campaigns that track engagement metrics, how many clicks, how many attendees, how effective their outreach is at changing your habits. That's data harvesting, plain and simple. Your behaviors, your responses feed into their algorithms to refine the next round of psyops, and inclusivity, as long as it fits their narratives. Dissenters, well, those are the misinformation mongers that they aim to silence. Now, during COVID, they spent over $200 million on communications alone. That's our money. Hiring influencers, running ads that played on fear and division. Families were torn apart, businesses were crushed. All while the Public Health Agency patted themselves on the back for saving lives with things like commemorative coins, remember? No accountability, no apologies, and today in 2026, they're doubling down, tendering for more contractors to keep the PSYOPs running steady. This kind of surveillance architecture needs constant feeding, after all. Healthy living campaigns today and mandatory tracking apps tomorrow, like the notorious ArriveCan scandal. It's all connected. What Health Canada is doing isn't public service, but rather public manipulation. And the supposed experts at the Public Health Agency of Canada can't even keep PPE stocked, but are being entrusted to engineer the thoughts, behaviors, and daily choices of an entire population. Why are our tax dollars funding behavioral experiments without our say? You can contact your MP and ask just that. Share this far and wide, because if no one pushes back, they'll keep treating us like lab rats in their grand social engineering scheme. For Rebel News, I'm Tamara Ugolini. These psychological operations are being driven from the top down by the World Health Organization. To understand what this unaccountable, pharma-centric body is advancing and how it is seeking to institutionalize sweeping changes to democratic nations while bypassing parliamentary oversight, please watch my other reports at exposethewho.com. And if you appreciate this work, please consider supporting it so we can continue tracking and exposing these developments. All of that at exposethewho.com.